Hi, my name is Isla and I'm your chiropractor for today. Okay, now I can see our receptionist has already completed our pre-treatment questionnaire with you today. Yeah, and I can see that you've also completed your online consultation as well. Yeah, is that correct? Okay, perfect. So, have you ever visited a chiropractor before? I know this is your first appointment with us here, but have you visited anywhere else for any treatments? You have? Okay. Yeah, and was that for a specific concern that you had, or was it just general wellness? Okay. A tweak in your shoulder. Okay. Has that resolved now? Are you still getting any residual pain or discomfort from that? No, am I okay just to work around you whilst we're still talking? Is that all right? Okay, just let me know if anything's painful or anything causes you any discomfort today. Okay. So, with your shoulder, it's completely resolved. Yeah, no residual pain. Okay, maybe every now and again, just lean forward for me if you can a little bit, sweetie. So just a little bit towards me. Thank you. So maybe a little bit every now and again, but not really anything of concern. Okay. All right. Let me just feel at the back there. Yeah, so if you just still lean forward for me, thank you. That's perfect. Yeah, okay. And if you can just now lift your head up and look straight at me. Thank you. I just want to make sure that there's no ongoing rigidity or just restriction happening from where you had your shoulder problem, okay? All right. And if you can just pop your arm just across for me and then just look toward the window. Thank you. Yeah, and just stretch as far as you can. A little bit more if you can. Thank you. Okay. Now, if you keep your arm in that position, what I'm going to do is just touch some pressure points on your back. Just go ahead and let me know if any of those points are triggering for you. Okay. Okay, what about that one? No, not at all. And that one? No, you're sure? Yeah, okay. And just keep your arm if you can. Yeah, sweetie, so if you can just keep it, yeah, pressed against there. Fabulous, thank you. And just going to press down there. No, okay, good. And you can go ahead and pop your arm down. Thank you. So we're just going to do the same with the other arm. So now looking towards the door for me and stretching your arm that way. Thank you. Okay. Are you able to turn any more toward that way? It's absolutely fine if you can't. Maybe just try. Yeah, don't. If it's too painful, like I said, don't do it. We don't want to cause any discomfort today, and it's not necessary when you're visiting for you to be experiencing any pain in order to get better. It's not necessary. We don't need to do that. Okay. All right, so it does seem like you have a pretty good line of movement in there. And what about when I'm pressing there? No trigger pain. Okay. Okay, so sometimes in the neck, so I have noticed on your consultation form you have jotted down that you're having neck problems as well. So don't worry, sweetie, we will definitely get to that. I just first of all want to just check this shoulder movement is not causing any ongoing issues. No pain there? No. And what about there? No, you're okay. Okay, sweetie, so you can go ahead and pop your arm down and just go ahead and look straight at me, okay? Thank you. So there feels like there is a little bit of tension still here, but I do think that is sort of possibly radiating towards your neck. So I'm just going to use a little bit of cream. Is that okay? Yeah. Sometimes it just loosens up the muscles a little bit, which makes it a little more accurate for me to actually assess what's going on. Okay. All right, and if you can just lift your neck up slightly for me. Thank you. Okay. All right. Any discomfort there? No. I'm now just going to press some points along your arms. I want you to go ahead and let me know if anything triggers anything, okay? Sometimes we can have referred pain, so I just want to make sure. No, and if you can just hold both arms out for me, thank you. No pain, no discomfort. Good, good. What about when I'm just slightly applying some tension there? No? Good. Awesome. All right, and now this one. I'm just going to go ahead and get it from that angle. And the exact same on this side, just going to apply a little bit of tension. No? Good. Awesome. All right. So it does look like your shoulders, yeah, you've regained movement really well. It doesn't look like there's any ongoing concern there for me either. All right. Okay. So before we go on to the neck problem, because I know that is your primary reason for coming in today. Yeah, okay. Before we address that, I just wanted to go over your x-ray and MRI results, okay? I know one of our nurses has rang you and they've kind of relayed the information, but it is important for me to just quickly go over these with you today as well, okay? We do. So we do these with every new client. It's really important before we start any course of treatment that we're actually making sure there's no structural abnormalities or no issues that we could actually be exacerbating here in the office, okay? All right. Just get my pen up here. Okay, so as I just touched on, there's no overt abnormalities. Your alignment here is really good. There's no rotation, which is something we would be looking for if we're trying to detect any abnormalities or any structural issues. The anterior and posterior vertebral line fall along this smooth and continuous line, which again is something indicative of a healthy x-ray, okay? The intervertebral discs, they're all similar in height and there's no obvious loss of height, which again, indicative of a healthy x-ray, okay? Now, I can also see that you had an MRI done and that was in December. Is that correct? December just gone? Yeah. And again, with this is something I would be looking at when I'm addressing any soft tissue abnormalities and there's nothing on here that stands out to me. This is completely healthy, and there's nothing, as I said, abnormal detected on there, okay? So these just really give me the green flag to go ahead. It just gives me that reassurance that I wouldn't be exacerbating any problems that I wouldn't necessarily be able to feel, but they would be picked up on the x-ray or the MRI, okay? All right. So I'll pop that there for you. And that's absolutely not to negate any pain you're going through. Just because something hasn't shown up on the MRI or the x-ray, that doesn't of course mean that you're not experiencing that pain, and that's really important. I make sure my patients are really aware of that. Okay, now what I want to do is look at your neck problem, okay? But the way I work is really slow and steady. So as I said before, there should be no pain or no discomfort, okay? If you do start to feel any discomfort or any pain, I want you to go ahead and let me know, because it's a really good sign for me that maybe something else is going on as well, okay? All right, now just putting a little bit of cream. So whilst I'm looking at your neck, I want you to just go ahead and tell me a little bit about when the pain started, and let me know when the pain is worse for you. So is it worse when you're waking up, or is it pretty consistent, or do you find it's a little bit more sore in winter or summer? Yeah. Okay. Okay. So you're finding you're actually struggling looking from side to side without having to turn your body, okay? That's definitely not what we want, so we need to work on that for you, sweetie. We definitely don't want to be moving our neck like that. The neck, of course, is supposed to rotate. We don't need to move our body in order to move it, that's for sure. Okay, just look up for me if you can. Thank you. Okay, just going to apply a little bit of tension at the back of your neck. Let me know, as I said, if there's any pain. No? Okay, there's definitely a knot there. I can feel quite a heavy knot at the back, which is not what we want. Okay, and what I would like you to do is try and turn your head just as far as you can toward the window. Don't go any more than you usually would, okay? All right, sweetie, yeah, perfect. And I'm just going to apply a little bit of pressure there whilst you do that. Okay, yeah, perfect. Are you able to move it any more toward that way? No, that's absolutely fine. Don't stretch it, like I said. Don't stretch it too far. We don't need to be doing that. Okay. Yeah, so you have about a 15-degree turn there, which is definitely, it's something we can work on, okay? It's definitely not normal for your age to have such a restriction there. I'm just going to try and loosen it a little bit just to see if that helps a little bit more. Just create a little bit of friction there, maybe. Okay, just try and go a little bit further if you can, but as I said, don't push it. Okay, perfect. Okay, and if you can do the same but toward the door now for me. Thank you. Just get a little bit more cream. Yeah, and that's absolutely fine. Don't stretch it, okay? I know it's difficult. When you're in here, you almost kind of want to push it a little bit further, don't you? But no, absolutely don't do that. Okay. Just gonna tweak Thank you. A little bit there. Okay. Yeah, and gently come back in the middle for me. Thank you. All right. So there's a lot of restriction and tension there. Okay. All right. Now what I'm going to do now is just start to make some minor adjustments, okay? And I will be stretching the joint. I will give you notice, and you may hear a popping or crackling sound when I'm doing these adjustments, okay? It's perfectly normal. We all have a thick type of fluid surrounding the joints in our body. And when I conduct the adjustments, the pressure will just slightly alter, and it's the pressure change that causes that popping sound, okay? So absolutely nothing to worry about, and you shouldn't get any pain when I'm doing it, okay? All right. I'm going to go really slow and actually a little bit strategic with the neck ones, okay? So I'm going to press down here, okay? And what I want you to do is, as I'm pressing down, I want you to turn away from me, so toward the window, okay? Perfect, okay? Deep breath, and I'm going to count to 3, and then I'm going to make that adjustment, okay? All right. So deep breath for me. Thank you. Okay, and 1, 2, 3. Perfect. Okay. You feel okay? Yeah. And I'm just going to now do a little bit more. I definitely can tell there's a little bit more there. So, and again, if you just keep on looking that way for me. And 1, 2, 3. Perfect. Awesome. Okay, how does that feel? Yeah, good, good. Okay, and I want you to do the same, but just turn to that way for me now. Thank you. Okay, just gonna warm it up a little bit. Yeah, if you just keep on looking that way for me. Perfect. Thank you. So we're going to go again. Deep breath for me. 1, 2, 3. Perfect. Okay, good. Okay, there is a little bit more. So if you can, just keep on looking that way. Perfect. 1, 2, 3. Okay, awesome. And just turn back toward me. Thank you. Okay, just gonna get a little bit more of this. All right. How did that feel? Yeah, you almost get an instant kind of relief, don't you, where you feel like you can move a little bit better. Okay, right. And are you okay for me to go ahead and make a few more adjustments? Beautiful. Okay. All right. So I'm just going to go a little bit further down your back. Any pain or discomfort when I'm pressing there? No? Okay, beautiful. Okay, so I'm gonna do a few more, okay? Go ahead and let me know if it's too much and you want me to stop. So 1, 2, 3, perfect. Okay. And again, 1, 2, 3. Beautiful. Okay. Now if you can look up for me. Thank you. Just going to go a little bit on your scalp area and just around your temples, because there's of course a connection system there that could be triggering that. Does that feel okay? Yeah, all right. Just around your nipples. Perfect, okay. And just a little adjustment here, sweetie, for me. So you may just hear a very slight popping sound here because it's a very small area. So deep breath. Perfect. 1, 2, 3. Beautiful. Okay. All right. Now, how does that feel? Beautiful. Yeah, so sometimes, like I said, you can feel that instant relief, okay? So if you can just turn. Yeah. Beautiful. Okay, so you can already feel there's a little bit less resistance there. Beautiful. Okay. All right, and the other way for me. Thank you. Perfect. Yeah, you're okay. All right, sweetie. Okay. All right, just gonna go back to the scalp again. Now, how are you feeling? Yeah, good. Okay. What I'm going to do is just give you a few minutes, just because you haven't been here before and we are working at quite a pace. I'm just going to give you a few minutes just to have some deep breaths. I'll go and get you a drink and then we'll continue. Is that all right? Okay. Now, what beverage would you like? We have tea, we have coffee, and we also have some fruit juice as well. Yeah, some tea. Okay. Would you like a herbal tea or just a standard? Yeah, maybe some green tea. Okay, absolutely. We do have a few flavors actually of green tea. So we have some jasmine or we have some mint. Some mint. Okay, yeah, absolutely. All right, sweetie. So I'll just give you a few moments, then I'll go and get your drink and then we'll continue, okay? All right.